So this is a really exciting study in hairy cell leukemia, looking at hairy cell leukemia patients who aren't expected to benefit from standard therapy with purine analogs. So that's patients with relapsed classic hairy cell leukemia and those with a variant. We've previously reported results of this study, but this is actually the full 44 patients for the primary endpoint of the study. And it included a relatively high fraction of patients with the variant at around 27%. And the extended results look very similar to the initial results with an overall response rate of above 50%. So I think our final was actually 54%, which really underestimates how beneficial ibrutinib is in this population. The progression-free survival was actually very flat at right around about, it was like 73% of patients having a very long-term progression-free survival. And with extended follow-up, this is also true that we're seeing these very long remissions in about 3/4 of the patients with the drug. So I think, when you see hairy cell leukemia, the overall survival is usually very good because this is a more indolent B-cell malignancy, but it's just really nice to see the progression-free survival continue to hold up very well and to have that stable curve with extended follow-up, especially in this group of patients that aren't expected to benefit from purine analogs or some of the other therapies. And of course, the median prior therapies was 4. So this is a heavily treatment-exposed population. The other thing that was very exciting was a subgroup analysis, and this was a not previously planned exploratory analysis, but we did look at differences between the variant and classic hairy cell patients, and we looked in both patients at the pre-specified assessments for overall response at 32 and 48 weeks, and then best response at any time, and found no difference in overall response rate between classic and variant patients at those times, and no significant difference in progression-free or overall survival. And while the sample size is small, and that was an exploratory analysis, it is really exciting to see how well ibrutinib works in patients with the variant, because we know that with purine analogs, the efficacy results are much less favorable. It doesn't work quite as well for our variant patients. So that was probably the most exciting results of the study. Of course, we did continue to look at safety and really didn't identify any adverse events that weren't previously known with ibrutinib.